So we're going to move into a panel discussion now. This is going to be about communities in a crisis, obviously very topical. I don't need to tell you that. But obviously the last year has been very challenging and tragic in very many ways, but has also been an enormous learning experience for those who are engaged in trying to promote community power. I'm very pleased to say that we have Vidhya Alakeson, who's Chief Executive of Power to Change, will be chairing this session. Vidhya and Power to Change is a total powerhouse driving forward the community power message. If you don't know Power to Change, do check them out. A truly amazing organization taking community power message into the world of business. Some people are thinking at the moment, what is the future vision for the economy? Power to Change is the future vision of the economy. Locally focused, social purpose, small businesses really driving forward meaning and outcomes in their local area. It's happening, it's real. So very pleased to have Vidhya here. Vidhya, take it away.
Thanks very much, Adam, and welcome to everyone to this session on communities in a crisis. I was just reflecting this morning that this time last year, I was at the 2020 Stronger Things conference, the last thing I did before we went in person, before we went into lockdown. And so it's fitting that 12 months on, we think about communities in crisis and what we've learned over the last 12 months. And I think as we now sort of see the glimmer of hope of emerging from this pandemic, we do so with a real sense of community as our first line of defense. I think we've all learned that the resilience of ourselves as a country depends not only on the competence of our national government, on the strength of our businesses, but also fundamentally on the strength of our communities and that community infrastructure that we have seen be so critical over the last 12 months. And I think at every turn through this crisis, we've seen local and community responses outperforming, out-trumping national centralised responses. We've seen that in spades. So at all levels, whether it's neighbours and friends, whether it's mutual aid groups or larger scale community organisations, these are the ways in which we've kept ourselves well, kept ourselves connected, stayed safe, ensured that people were fed, ensured that people had the very essentials that they required. But I think also COVID has revealed, sadly, a very dark underbelly of inequality in our society. And it's not that this is new, we all knew it was there before, but there a very bright light has been shone on it. And I think in many of the responses to that, we see community as some of the most powerful ways in which we will tackle this going forward. In our work at Power to Change, which Adam very kindly spoke about, we support community businesses across England, and it's been pretty awe-inspiring to see how community businesses have responded during COVID, innovated their business models, completely transformed the way they do things to continue to meet local needs. Whether it's been putting services online in a matter of weeks to continue to support people with health and mental health issues, whether it's been converting from in-person pubs and cafes and shops to doing online delivery to ensure that their local communities continue to get the food and the supplies that they needed, or whether it's doing very simple things like providing arts and craft materials for kids to ensure that communities had activities to do in lockdown. Community businesses have been at the forefront of their community responses to the pandemic over the last 12 months. And there's a lot that we can learn from what we've seen for those crises that we know, unfortunately, and inevitably will be to come with things like climate change. So I'm really delighted to chair the session today. Got four fantastic speakers who come from a range of quite different perspectives on this. I will introduce them each in turn as they speak. To remind you once again, as Adam said, please do start putting your questions in as you hear the panelists speak. We've got a good 20 minutes for questions at the end. So you'll hear about 5 minutes from each of the panelists, and then we'll have a chance for Q&A. So I'm first going to turn to Dr. Mark Spencer, who is the GP behind Healthier Fleetwood, which is a unique community health building initiative in Lancashire. Mark, look forward to your words.
Thank you, and good afternoon, everybody. Fleetwood is a very disadvantaged community sitting on the Lancashire coast, just the north of Blackpool. And I've been a GP there for nigh on 30 years. And it was quite apparent some 5 years or so ago that the health outcomes were getting worse. We were already having much lower life expectancy than the England average, very high prevalence rates for all long-term conditions that you can think of, and our health outcomes were getting worse. So we got going with something that we call Healthier Fleetwood. And Healthier Fleetwood is genuinely resident-led. It's resident-led to address the health issues that face the town and that face individuals. And it empowers residents to take control of their own health, their own lives, and their own community. And then sitting around that entity are all of the partner agencies that have input into the health and well-being and the lives of the resident of the town. So the NHS, local authority, schools, housing, the faith sector, charities, voluntary sector, and so on and so forth. And in the 5 years that we've been established, I've seen some amazing outcomes. Individual people's lives have been turned around. And where there was despair, there is now hope. Hope on an individual basis and hope on a community basis. And then COVID arrived. And really, if you ever wanted to have something in place prior to a pandemic hitting a community, then for us, Healthier Fleetwood was that something, because we were already deeply connected with our residents and our community. And those agencies were already connected with each other. So the most important thing for us, as always, was to listen to what residents were asking for, were needing, what mattered to them as COVID hit. And the first thing simply was access to food. So many people instantly lost access to one of the real basic elements of existing. And our food banks moved from maybe providing food parcels to 300 people a day to 1,200 a week to 1,200 people a week. So a very significant escalation, which then required more premises to dispatch the food from. So the local authority came into play with the provision of premises, and then we needed transport and volunteers and cars. So the whole of the volunteering service came into play. The big priority was also to stay connected to others and try to overcome that social isolation, not only from shielding, but also people that were voluntarily staying at home to stay away from the virus. And all of those groups that we'd had going previously, the singing group, the gardening group, befriending groups, they all just had to stop overnight. So again, harnessing the power of our volunteers to stay connected with people, either online or on the phone, or standing at somebody's front gate, and so just having socially distanced conversations, using our health and well-being workers, using the primary care networks, social prescribing link workers to stay connected with people. And we have managed to reach out to every single individual in the town. Nobody has been left alone for the year of this pandemic. And then more recently, the residents have really wanted to support the vaccination programme. So again, volunteering into that, not only being present to marshal the car parks and the social distancing, but also residents have been producing their own videos, encouraging people to come and get vaccinated. And the vaccination rates have been amazing. More recently, though, we've started to think about the future, because the economic downturn that's going to hit disadvantaged communities is going to be huge. And therefore, there could be a potential big impact on people's health as well. So we're already looking to the future for young people coming out of schools, looking for jobs, the future of people that have been made redundant during the pandemic. And the energy is now focused on what does the future mean for our town post-COVID, and how can we reduce the health impact from an economic downturn. So I think I'll leave that there for now, if that's all right.
Yeah, that is fantastic, Mark. I mean, I love the fact, and a real credit to you and everyone you work with in Healthy Fleetwood, that no one locally was left alone. I think that's an incredible achievement, but what was also really interesting, what you said, was the fact that what you built prior to COVID then really kicked in to support people locally, that infrastructure that you constructed over probably many years was the thing that really can see you through. And what I loved was the idea of residents at the centre, agencies around them. So, really resident led, but working with the other agencies in the local area. So a lot that we can build on there in questions, and I'm sure that others will pick up on. So thank you, fantastic. And now we're turning to Edna Robinson, who is the chair of the People's Powerhouse. People's Powerhouse is a platform which gives voice to those who are often unheard in discussions about the future of the north of England. It's growing to become a very powerful alternative platform for decision making and policy and thinking about the lives of the people in the north. So Edna, fantastic to have you.
Thanks, Vidhya. Great to be here. And thanks, Mark. Really interesting to hear about Fleetwood, and well aware of your work, and I'm sure we'll connect after today. Power, big word, isn't it? And I'm wanting to explore both soft power and how we can really energize the issue about putting the right people in powerful places. And we were formed from a protest around the Northern Powerhouse, which was a power grab of a group of very senior politicians and business people in the north who made it clear that they were clear about what the future of the north would be. Many of the people in this room today protested at that time about it not being diverse, not being inclusive, not being a true representation of the people of the north. And so that was 4 years ago. And I think we are turning in that the people are the true powerhouse of the north. We've spent the time during COVID really working to connect people across the geography from the east to the west of the north. And during that time, we've hoovered up all kinds of amazing organizations so that they can talk to each other, to share best practice, to continue to be positive. Because the power in communities comes from their ability to speedily identify issues. Because they're there, they're already it. They build up and connect systems and networks very quickly. We've just heard from Mark how that ability to morph from one thing into another. There is a humility about community power. There's not the same issues of dominance. Predominantly, the issue is about effectiveness. And when those communities are connected and when they're working really well together, they can then morph into new sub-communities. And we've seen during the pandemic, communities around hardship. So the amplifying of the work of food banks, the amplifying of work around discrimination. And we've seen in the issues of discrimination, we've been running a racial justice network across the north, and that's turning us into more energy around anti-racism. And if we've looked at the issue of racism and discrimination during that, we've actually seen communities come forward. We've seen the Lancashire BME network working really well to actually raise the profile of these issues. And I just wanted to mention the issue of taking the knee and the whole issue of why that has stayed as a powerful issue for the people who own that in the football community, because it's their issue and they have stayed in control about whether they give those messages or not. They've not been pushed aside by the system saying that this is something that we're all slightly embarrassed about or it's yesterday's issue. And communities, be they communities of geography or communities of people, will decide what the issues are and they will keep them on the agenda. So my message is partly to local authorities today, because that's why we're here. I want to hear less of the negative language about communities, using the words like deprivation and so forth. Communities need enriching if there are things missing. Let's use positive language because that will help to find the solutions. We also need to encourage local authorities to be moving away from contracting cultures to help communities come together so that there's less about bid writing and less about one community competing with another. Seeding sovereignty into communities to create real power, real economic power beyond soft power is not easy. And it can cause all kinds of controversy within institutions that want to hand that power over. So recognize it's a tricky thing to do, but the hard economics of what we're hearing about the thousands of organizations, mutual aid organizations, Oldham Inspire Women doing amazing things with their communities, the COVID Families Network, Slunglow Theatre turning itself into a food bank and so forth. We've got hundreds and hundreds of soft power examples. But the real challenge to us now is, how do we turn that into hard economic power? How do we ensure that we're not being patronizing ourselves by being too celebratory, when in fact the power is somewhere else in another room? We'll be spending the next year in listening exercises across the North, where we're bringing the powerful people into the room to listen, not to talk, to have some humility, and to actually really share how we can build this together. So for me, the whole issue is about not just communities of geography, it's communities of interest coming together, where we can recognize that if we don't fill that vacuum with that positivity, that positive language about our communities that need enriching, we will get communities of anger that will fill that space for us. And we've seen that in many communities where anger and negativity starts to fill that vacuum. So this isn't a flat situation where we can do the nice stuff and nothing will worsen. We actually do have to get to grips with some of this. And my message is, let's think very carefully how we get this amazing humanity into the hard business community now and really pull together.
Brilliant. Thank you very much, Edna. Very powerful. So much there about positive language, about a shift in the culture of how we work with communities. So less talking, less competition, more enriching, more enabling, more collaborative approaches. But also this something, what's at the heart of what you were saying for me was, it's great that we've seen so many powerful examples of what you're calling soft power, but we also need to see that translating into real economic power, and that those decisions can't continue to sit in a different room on the other side of the building. And I'm sure some of the other speakers will pick up some of what you said. So thank you very much. We're now going to turn to Anna Severwright, who is the convener at Social Care Future. So Social Care Future is a network of people and their families who draw on social care alongside people who work in social care and other campaigners. And we at Power to Change have been really proud to support some of the work of Social Care Future over the last couple of years. So Anna, what's your take on communities in crisis?
Thank you, Vidhya. And I'm really pleased to follow on from Edna, because I think quite a lot of our themes probably overlap. So for us, power is really at the heart of what we as Social Care Future do, and kind of why we were set up, because we got to a point a few years ago where all the conversations that were happening around social care were happening in large conferences and large meetings without any people in them who actually themselves drew on social care. And effectively, we started to try and challenge that and say, well, bring people in. And we were sort of told, well, no. So we just decided to do it ourselves. So we set up, and we've been at the heart of it. We've always made sure that people with lived experience or their families are really at the heart of the organisation, but supported by the wider sector, I suppose. And community is also at the heart of what we believe. So we co-produced a vision for social care, which is much wider than social care, because really it's about people's lives. So we all want to live in the place we call home, with the people and things that we love, in communities where we look out for one another, doing things that matter to us. So that's at the heart of everything we do. And I suppose looking at communities in crisis, I was thinking last night, what is my community? And then I realised, actually, as a disabled person, for me, often my community is the sort of disabled world. And interestingly, through COVID, the world went online. And in the first few weeks of lockdown, I actually felt more a part of the wider community and the country than I had done for years. Because prior to that, I was often stuck indoors when I'd like to be outdoors, taking part in the community, but I didn't have the right support or enough support to be able to do that. Whereas suddenly, all the things I wanted to do, if I wanted an exercise class, I wanted to watch the National Theatre, I wanted to be in a choir, I could do them all from my home and I could be a part of that. So in one way, lockdown was quite empowering for some of us. And the other thing, as a disabled community, we were saying, we're used to this. We're good in a crisis. We know how to cope when you're stuck indoors for months. Come and talk to us. And actually, I think that was a missed opportunity. But we saw lots of things springing up. There was an online pub called The Staying In that was set up by disabled people for disabled people that was very accessible. And so there were a lot of innovation that came out very quickly amongst the disabled community to try and adapt to this new crisis. And again, a lot of people were shielding. But then what happened was this term of vulnerable suddenly magnified and was used by everybody. The vulnerable, we must look after the older and the vulnerable. And we got labelled and lumped into this group with this term that is quite disempowering, to be honest. I think that term conjures up this idea that we need looking after and that we are sat waiting to be helped, looking after, takes away people's agency, and it creates this idea that people don't have their own power. And I think what is wonderful about things like mutual aid is that idea of reciprocal power. I can't say. You know, it's that idea that actually everybody benefits from this and everybody has something to bring. And what I think the worrying side for me of COVID has done was actually to suggest that there are this idea that there was this vulnerable group, you could volunteer and be an NHS volunteer and look after the vulnerable. And actually, disabled people, older people, everybody in society has something to bring. And that's at the heart of what we at Social Care Future want to see and believe. So for me, it's how do we do an inclusive crisis response? How do we make communities really inclusive, and how do we value everyone's contribution? They might be different, but how do we say, actually, you know, things like Good Gym are great because you've got somebody who's benefiting from that time, but you know, both sides are benefiting from that arrangement. Or shared lives where a disabled person might go and live in someone's house, but actually we hear over and over again from the families that take someone in, actually what a massive difference that has made to their lives. And it's that idea that actually it's not being looked after or doing to, it's doing with and as part of. And for that to happen for us, you must involve the people that themselves draw on the services. And that unfortunately often still does not happen. You will see big conferences, you will see big meetings with nobody there actually who uses services, or maybe one lone voice, the token in the corner. So at Social Care Future, during the COVID, we have set up an inquiry into social care led completely by people who draw on social care themselves. We've got people with dementia, people with learning disabilities, people with physical disabilities, or family carers. And we are saying enough is enough. We're going to set the agenda. We're going to look into this. Obviously, we're going to hear from everybody involved, people who work in the sector, but actually we're going to try and take back some of that power and actually demonstrate that we have agency, we have ideas, and we can do it ourselves. So that's all from me. Thanks.
Brilliant, thanks. Thank you very much, Anna. And you know, I've known you for a bit, and vulnerable isn't a term that I would ever use. Valuable but not vulnerable, which I think is, you know, is the shift that we want to make. But also, I think what you were really pointing for me was that the nature of the systems and the communities that we construct need to have mutuality at their very heart. Like, actually, we need to think about how we create systems that have mutuality that rooted into them, that actually we don't have those who need help and those who help, those who are disadvantaged and those who are better off, that actually we all bring a contribution. And how do we create systems that can really be rooted in that idea and then operate in that idea? And it's really challenging. So I'm doing some thinking about it with some colleagues, and it is very challenging because when we get power in the mix, it's often quite hard to hold on to that sense of mutuality. But I think there's something very important in that idea. So finally, our last speaker, but by no means least, is Paul Gutherson, who is the Empowering Places Coordinator for Centre 4 in Grimsby, and is someone who we at Power to Change have worked with very closely over the last few years. So Paul's going to talk about his highlights and experiences from communities in crisis over the last year.
Great. Thanks for asking me to share my thoughts on Centre For's experience over the past year. I think first I need to just acknowledge the amazing work being done by other organisations and businesses and individuals across North East Lincolnshire. It's every one of us trying to make a difference, mainly by acting with kindness. There's many of us out there, and it's not just community organisations. But Centre For and the community businesses we work with through Empowering Places have responded to the challenges of the past year in different ways. But I think we've benefited from a long-standing and strong relationship we've had with the local authority built for over the last 20 years, if we're honest about it. And that relationship has grown stronger over this year, especially, I think, on the basis of a trust in us to deliver in a human-centred and relationship-based way. So our community businesses have all done their bit to improve outcomes for local people. Thrift Shop has put together parcels of clothing for families and individuals escaping domestic abuse or homelessness, or just because they found themselves in a bit of a spot. And it's just neighbours doing something. It's no judgment. It's just people helping. Our community gym has, when it's been able to be open, been open because the members needed and wanted it. They're the people that have come in and cleaned in between sessions. We discovered a new gym member who was qualified to do the gym inductions. And so that's just the community doing it for themselves. Another community business that we work with is Nunny's Farm. It's an urban small breeds petting and care farm on our grounds. And when it could be open, they reached the fantastic milestone of 10,000 visits this year. So that's mainly local people getting out to a local facility and just taking part in something, connected with nature and connecting with each other. And actually in the first lockdown, we even managed to open a tool library just to help people to take care of their own environment, which actually sounds really but it actually helps with their mental well-being as well. And these are all based on the community acting together to support other members of their community. Centre For has a recruitment agency, Era Employment. And actually the response of Era has been, I think, incredible over the past year. I mean, if we go back to last March, Centre For's community organisers did as many did elsewhere. They flyered the whole estate going, look, who can help and who needs help? But what we did, because we've got a system as Lotto points-based reward system, which rewards people for getting involved in social action. We adapted that system to help people coordinate people so that, yes, people needed shopping. Yes, they needed prescriptions picking up. But actually what we did, we had conversations, and the people who needed help, they wanted those things doing. But what they really needed was somebody to do their garden for them, because they were feeling down when they were stood at the sink washing up because their garden was getting in a state and they couldn't do the garden. They needed somebody to turn on Netflix for them because they'd been paying for it for a year, had no idea how to use it, just needed somebody to talk them through it. But that's about people helping people, sharing knowledge, skills and time. And as we were doing that, we started to get requests from our own social prescribing service. We started getting requests for help from the council and CCG funded services who wanted and recognised the way that we were doing it was a better way than they could do it. So I think following on from that, we ended up managing a hardship fund for the local authority, but the money wasn't the key thing. It wasn't handing over that £20,000. It was the conversations that we had that mattered. And in those conversations, it was about linking people to other groups that were closer to them, to tying them in with advice and support that might be delivered. Yeah, it might be a local authority service, it might be a community organisation, it might be a private business. It's all connected, and it was just all done with understanding and listening. And I think what this did, though, is it showed the local authority that you can do people-centred work, and you can be organised, and you can be efficient, and you can meet the outcomes that they're looking for. And yeah, we were undoubtedly helped by the fact that the things that were in the COVID response and the things that were there, it meant that officers and members could act more bravely. They could make decisions to cut through some of the unnecessary process and bureaucracy that exists. And I think after many years of talking about being an enabling authority, they actually took that step to really being enabling. And I think partly because we started to understand what that meant, not just the authority, but we as community organisations began to understand. So what was amazing for ERA was also that meant that we were able to then place people into temporary work, because the local authority came to us to fill some of those roles that became available, COVID support assistants, and we were able to help people who had been working in the entertainment industry or the hospitality industry, which is massive in Cleethorpes and North East Lincolnshire, to transfer their skills and work in roles that just didn't even exist a year ago. So they were pivoting. It's not just organisations that have to change their outlook, but they were able to do that. So I think what we've learned from this and what I think we need to carry forward for the future is, I think there's 4 things. Firstly, everyone, the local authority and the community organisations need to keep being brave. We all need to keep trusting the community to find solutions, and we all need to continue to step back and to be enablers. Secondly, I think we need to recognise that the work that has just happened is just the start, and we need to build on it. And we're looking to create a wellbeing hub, and which builds on this collaborative approach to supporting communities and building active citizenship. Thirdly, the people we work with are not patients, customers, volunteers, and they don't have mental health needs, and they're not disability, they're not vulnerable. Before all else, they're just people. We're all individuals with complex lives and things going on, and sometimes, we can find ways to work together in a way that is meaningful for us all and helps us all to grow. And finally, and I think we've touched on this already, is that just because this is people and communities doing stuff, it doesn't mean it doesn't need to be resourced. And it doesn't mean that there doesn't need to be an infrastructure that sits underneath it. So we need to invest in the social infrastructure and things like the collective community imagination to make change keep happening. Thank you.
Brilliant, thank you, Paul. And I've been lucky enough to come and see the work of Centre for, and I love that petting zoo. It's amazing. This estate is a wonderful petting zoo, petting farm, and but it's fantastic to hear how things have evolved since I last came to visit. It's been a real privilege to listen to the 4 of you. Been incredible contributions. I think what's coming out from what you've said collectively is, the need for kind of community infrastructure rooted in kindness, mutuality, relationships, and sort of no labels, people as people rather than people as diagnoses or whatever other label. And then how do we get public authorities and systems to work with that as the real core of what's going on, and to enable that in a way that allows it to thrive and prosper? And how do we then invest in this going forward? That feels, if I was going to try, and I'm failing to summarise all the richness that you presented, but that feels like some the direction of travel of what you've all said. So we are throwing it open now to questions. Thankfully, somebody has been managing the chat, because it's been on fire, which I think is something about the power in this movement that is collected here, in terms of more and more people kind of being drawn to community power. So I'm going to ask the questions that are coming through from the chat. Some of them are for individuals, some of them for the panel in general, so I'll kind of direct them appropriately. So the first one is for Mark. Mark, is there something special you feel about Fleetwood, or could the approach that you've described work anywhere? And if so, what are the critical ingredients that make it work?
I certainly don't think there's anything. Well, yes, Fleetwood is very special. Every community is very special. So yes, there are things that are very special about my community, but the methodology it isn't special. The principles are really very basic, and that's 2 things. One is listening. Long-term, deep listening in order to understand what really genuinely matters to the human beings in that community. And I don't mean just a simple one-off engagement. session where people come in and say they're listening, but they're not. This is long-term listening, month in, month out, year in, year out. We're listening with purpose to help and support. And the other thing that I think we have got right is control, and people in leadership positions being brave enough to give up control and hand that control to the residents. And again, that doesn't happen overnight. We're on a 5-year journey, and more people in leadership positions are willing to give up control and allow things to happen without actually defining what the outcome's going to be. But it's just better than it is today. So let's just go on a journey together.
Brilliant, thank you. Listening has come up repeatedly, hasn't it? And maybe the reality is that power leads to a lot more talking than listening generally, and we need to invert that quite desperately. The next question I'm going to direct initially to Edna, because you raised this, but I will come to some of the others of you because it's come up several times. So it's a question from Carol Donnelly. So how can VCSE and community groups, so voluntary and community sector, social enterprises and community groups, open up discussions with a local authority that struggles to share power? So Edna, what are your thoughts as to how we can change that dynamic that you raised?
I think it is about relationships, isn't it? Because beneath the vestiges of the power, which is either the institution or the offices or what, there are people sitting in those places. And so it is about trying to build relationships and then put your proposition together, be clear what your impact can be, clear what your offer is, and make it tantalizing. That actually, we've heard today that this is such a diverse set of inputs that lead to amazing solutions. And we know that communities that are grassroots and others that are very creative will come up with solutions that the system just can't, because it's too clunky or it's too slow or it's not. So I would just say, do your homework, be clear what your proposition is. There's lots of people, lots of us around who will help organisations to really focus on their, I mean, one of the strengths of our Powerhouse is we've got so many people working pro bono who will just offer their expertise and guidance. Because again, we don't want to see industries emerging out of all of this, because we're already seeing bid writing industries, we're seeing community consultation industries emerging. Everybody's commoditizing this stuff if we're not careful. So let's remember that all the things we've heard this morning are about the human to human relationship. And so just, you know, get your act together before you make the approaches, but absolutely make them. And if it's a cup of tea and a bun that will get the person in the room, if it's a group of community activists who have got some really good stories to tell, just think creatively. But really, it isn't easy, because ceding power and giving sovereignty is probably the hardest thing of all that we expect people to do. And when we're serious about it and it's real community assets, buildings or big contracts, then, you know, we're back into the big boys and the big games again.
Great, thank you, Edna. Anna, I wanted to ask you the same question. So Social Care Future almost set up because of a challenge of accessing power and kind of seeing things done to you rather than with you and led by you. So has that changed? Has that dynamic changed now, or how are you kind of approaching that now?
Yeah, I suppose the dynamic has changed a bit, and sometimes, so we still at times do perhaps use the voice of protest at times, but we also are often in meetings with people and have built relationships and trust, and so we use a variety of the different skills. And I think at different times perhaps you need the different levels of you know, challenge. But I think locally, for me, certainly with local authorities, where we often see it is with things like direct payments, where somebody would get a payment and then in theory can then direct their own care and support. But the reality for a lot of people is then you get a million rules that say what you can and can't spend this money on, and it's no longer actually self-directed support at all. It's just, yeah, it doesn't do what it was originally meant to do at all. And I think for me, the keys really is it does take time. You need to understand, often there's a lot of fear in the people I've experienced in local authorities. Actually, they feel responsible for this money. And if I give you this money and then you do something, it will come back on me. And it's about trying to break down some of those barriers and to explore some of those fears behind. And actually, I don't think it's about them giving up power. I think it's about sharing power. So at no point am I expecting a local authority to suddenly say to all its citizens, here's loads of money, just go and do what you want with it. Actually, what I want them to do is to say, let's work together to actually allow you to do the really great stuff. So I think for me, it's about sharing the power. It's about using examples where it's been done differently, so that gives people confidence that it can happen. And yeah, that's it really. Build those relationships.
Wonderful. I can't believe we're almost out of time, but I want to ask one more question. So it's a question around a social model of well-being rather than a sort of more medical model around deficit. So we've talked about this already. So how can we shift to that sort of model? So I wanted to ask that first to Paul. How are you kind of building well-being and a different way of thinking about what success looks like into the work that you're doing at Centre for?
I think it builds on the things that people have said, that actually it's about relationships, and you don't go into a conversation with an agenda. If you go in with an agenda, it's a meeting, and that's a completely different kind of setup. So yeah, this is about those strong relationships and about building on what individuals have and recognizing that everybody has something to offer, and that's been said more than once today already. And we all share, and as a community we share, and we can reciprocate, and actually we build a social care model based on that, and that's what it's about.
Okay, fantastic. I am desperately sorry to all of you who've asked questions that we haven't got to, but we are unfortunately out of time. A huge thank you to Mark, Paul, Edna, and Anna. I mean, such a rich set of thoughts and experiences, and I think we come out of it with a sense of the kind of way in which we need to move forward, rooted in mutuality, rooted in kindness, in listening, in people and all of their attributes, and people as valuable assets, and then a system around that can enable people and communities to really take and exercise power. So I think we are learning as we come out of this pandemic a lot about the way forward. And as Paul said in his contribution, this is just the beginning. We need to build on what's happened over the last 12 months to strengthen this infrastructure, to grow it, to make it more the way we do things in the future. So a huge thank you to all the speakers. Thanks to those of you who've been listening in, and huge congratulations to New Local for what is already shaping up to be a fantastic event. And this is only day one. Back to you, Adam.
Thank you so much, Vidhya, and the panel for a really, really interesting session. It's so great to hear people who are really delivering stuff on the front line, really taking community power down into communities, into the real world. So much to learn there. Really interesting session.